evening to all of you, everyone around Nigeria and around the world, actually. Good evening to everyone in Nigeria. I'm not sure what time it is in North America. It's morning, 10 a.m. So good morning, good afternoon, wherever you're from, joining us from. Thank you for viewing this content. So today, you're from Nigeria TV. Many times when companies take a small break out of their usual commercial activity, to give back to society, to do something nice for society. You call it corporate social responsibility. I'm not sure what we'll call this one now. We're a gospel-focused theological apologetics social media channel, but today we're taking a break, and we're going to be doing something medical, bringing some content to you around some free and pertinent medical talk. Very important to share with us. And, we have a doctor on our panel. So, I mean, we're not going very far off. So Dr. Adetola today is going to be talking to us about diabetes. Interestingly, in the build up to this, I, suddenly realized I don't know much about diabetes except probably with something wrong that maybe you take too much sugar, you get diabetes, or I should never again go near chocolates in my life, or what exactly is it? I know that it's a major life changing, life impacting disease. But we have the doctor in house today to tell us all about this and to dispel myths and to give sound medical counsel. So please share this on your social media as usual. Share this with people who need to hear this. And one more thing I want to say. So we're happy with the way you, our audience, help us by pairing these streams. So I'm going to put while he's talking, Dr. Tito, I'm going to put the link again. We're using the Restream platform, how to share this on your own social media, so that when we go live, the stream also goes live on your wall, on your profile, on your social media channels. So thank you once again. Let's talk diabetes with Dr. Adetola.
Thank you so much for that intro. So we figured every now and then we should sprinkle with medical topics, because it's not just about, especially after last week when we did some heavy theological talk. It's about caring for the full man, and not just the spiritual man, but also the physical man who has to minister to the spiritual man. So the diabetes today. Diabetes is a chronic medical condition that affects the body's ability to regulate blood sugar. Virtually every food we eat, even whether you're drinking Coke and Fanta that Nigerians love to attack as the cause of diabetes, or even our regular food, the rice, the eba, the amala, even our fruits, they all have sugar. So now we can go further and divide them into simple sugars and complex sugars, which are better for you, but it's still sugar. So today we'll try and explore and tell you which one is the better sugar to take, and taking them in the right proportions. But it's still sugar, and diabetes is something gone wrong with how our bodies manage those sugars. Now, between 3.5 to 6% of Nigerian adults or African adults, or really adults everywhere, suffer from diabetes. Unfortunately, we Blacks actually have a higher percentage of adults suffering from diabetes. And we're living in an age where it's not just adults now. Because of obesity, we're beginning to see even children, teenagers, in increasing number suffer from diabetes. So now the latest figures that have been bandied around say something like 11 million Nigerians, and I'm talking adults now, I'm not even talking children, 11 million Nigerians are suffering from diabetes. Now that means a lot of money and time and energy is going into the care of diabetes. And unfortunately, from personal pocket, I'm not even talking from the government coffers, is going into the care of this chronic and very dangerous disease. For the case of simplicity, there are about three different types of diabetes. There's a type 1, which occurs when the pancreas is damaged and is unable to produce insulin at all. Now, let me stop there for a second. Now, insulin is like the escort. So every time we eat, remember what I said earlier on, it doesn't matter what we eat. At the end of the day, sugar is produced. And sugar, our blood sugar levels will go up, but the blood sugar has to go down and go into tissues and get stored there. The way that happens is our body produces a hormone called insulin. That hormone is produced by an organ that is located behind our intestine called the pancreas. So that insulin is like the escort. It helps to open up the certain organs like the body fat, like the muscles and the liver, so that the excess sugar in our blood gets stored in those organs I just mentioned, the body fat, the liver, and the muscles. So if if the pancreas is unable to produce insulin for whatever reason, blood sugar is going to stay high, and that leads to the condition that we call diabetes. So in type 1 diabetes, it means the pancreas is unable to produce insulin because pancreas is completely damaged. Now, in type 2, that's a bit different, and that's going to be our focus. That's the one you see. Type 2 is the one you see mostly in adults. In type 2, the pancreas is unable to produce enough. So it's still producing, but it's not producing enough insulin. Or for whatever reason, there is what we call insulin resistance. So people who are obese, for instance, the body is actually resisting the function of whatever little insulin is actually produced. So we have at least two distinct scenarios here. The body is not producing enough insulin, and the body is resisting the function of insulin, so that the body does not effectively use the insulin that is produced. And then we have the gestational diabetes, which is what we find in pregnant women. The placenta makes some hormones that resist the function of insulin. And so the pregnant woman, develop insulin. The good news is usually after the baby is born, these pregnant women tend to go back to normalcy. But those are also women that could later on develop diabetes for real. Now, sadly, many people, at least in our country, because we don't do preventative health care, we don't go for checkups, people tend to, this is the same way we treat our cars. We don't do regular checkup for our cars, and we do the same thing to ourselves. So people will present because something happened to them, and then they blame witches and wizards. So you can see a foot there. That's a diabetic foot ulcer. And I've seen patients like this when I was practicing in Nigeria. And people will say, "Oh, somebody put some medicine on the ground for him, and he stepped on it, and that is why this happened." But that's a diabetic foot ulcer. That's a diabetic foot ulcer right there. And it's not because sometimes I've seen people actually step on, 4-inch nail, and only God knows how long they've been carrying that around, and they don't feel it, they don't feel any pain, because the ability of those patients to perceive pain is gone. The nerves are damaged. You can see somebody holding a cane there. That's somebody who suffered a stroke. Okay. On the right hand of your screen, there, it says peripheral neuropathy. Those are people who people say Yoruba say paja paja. I don't honestly know where that terminology comes from. Paja paja means kill dog. But it's something like they are unable to feel sensation, or there is a burning discomfort because the nerves are damaged. In the leg, in the hand, especially in the glove, what we call the glove and stocking distribution. On the bottom left hand there is someone who is undergoing dialysis because the kidney is damaged. And there's a lot of that in Nigeria. People's kidneys are knocked out And in the middle there is someone who's gone blind, not just cataracts.
Oh, I'm sorry to cut in. Did you just say that people have their kidneys damaged because of diabetes and then they have to
Yes,
do
yes,
dialysis?
yes. Diabetes also does damage kidneys, and there's a lot of it, from diabetes going on in Nigeria. So very often it combines with with hypertension also, but there's a lot of that. I'll mention that. So there is stroke, kidney damage, heart attacks. These are things that can happen, and I want our people to see how not getting diagnosed in time or being very lax after they've been diagnosed, in terms of not following advice, how severe diabetes can be. This is very, very important. And then eye damage there, it can damage the nerves of the eye. And once these things happen, it's very difficult to reverse in many cases. So this is a very, very tough thing, and people need to pay attention. It's not because of some witch or wizards in your village or your uncle looking badly at you. And sometimes when these things have already happened, it's difficult to reverse them. It's very difficult. So pay attention, please. So how does diabetes happen? Remember, that's the stomach right there. It's really arrow. Okay, so we eat, the food comes in through there, we eat, and then food goes into the small intestine, and it raises our blood sugar, and it goes into the blood circulation, and that activates the pancreas. That's the pancreas right there to release insulin, and the insulin is released, and it guides, like I explained a few minutes ago, it guides the blood sugar. Whether you are drinking Coke, people say, oh, don't drink Coke, drink Maltina or drink beer instead. All of them are sugar. Just remember that. Maltina, just read the small print of what is on your Coke and Fanta and your Maltina. They are the same thing. So remember that, though your Maltina is not better than Coke. They are all just tons and tons of sugar inside the bottle, or Deku. They are all sugar. All right. So, and I'm not saying people shouldn't drink their Coke or Maltina or Deku or Star or whatever. Drink in moderation if you must drink. They're all bad for you. But that's not to say you can't drink one or two in social situation. Now, if when you're not producing enough insulin, or your body is resisting them, things get out of hand, diabetes ensues, and unfortunately, you will need to be managed. Now, without trying to waste time, who is at risk for diabetes? If you have a family history is very, very important. Uh, it seems that for us in Africa, we don't know. And I have a lot of Nigerians in my practice. And, I could ask a white person and they could tell me their grandfather, their uncle's history. But when you ask a typical Nigerian, they don't know what happened to their dad. They don't know their mom's history. They don't know their brother's history. Like, I don't get it. But anyway, family history is important because it allows your doctors and your primary care physicians to help to know what to screen for, not just for diabetes, for breast cancer, for colon cancer, and other diseases. Because if someone in your family, especially your first degree relative, that's your dad, your mom, your brother, your sister, has one thing, it increases your risk. Doesn't mean you're going to get it, but it increases your risk of getting those other things. So family history is important. If you have high blood pressure, it increases your risk of getting complications from diabetes. Um, uh, One of the things we do is once somebody is diagnosed with diabetes, we are going to put them on medication for diabetes, for cholesterol, which is the fat in the blood, and also for diabetes, also to prevent the risk that is associated with diabetes, like heart attack, like stroke, like kidney damage, which I mentioned earlier on. People who are fat, people who are carrying around a lot of fat, especially in their trunk, around the belly. Those are people who are also at higher risk of developing diabetes. People who already have what we call pre-diabetes, that is, you measure your blood sugar, it doesn't quite meet that bar for diabetes. That already increases your risk right there. Women who have especially young women who have what we call polycystic ovarian disease. So, you have a lot of cysts or you're growing facial beard, doesn't mean you're going to get it, but that risk is also there. We people, men and women who have schizophrenia or depression or who are bipolar, the risk is there. People with obstructive sleep apnea, and I mentioned it's not on the list. Those of us who are blacks, people who are Indians, or people of Asian origin, and there is something, people with dark velvety skin lesions. Usually, we find it in the back of the neck or in the armpits. The medical jargon for it is acanthosis nigricans. Those are people who are at higher risk of developing diabetes. Now, what are the symptoms of diabetes? If you're having any of these things, you probably should just go and get checked out. It doesn't mean you have diabetes, but go and get checked out. Certainly, especially once you've hit the age of 40 and above, go at least once a year to get your regular checkups. But there are what we call the three P's, polyuria, if you're peeing a lot, polyphagia, you are eating a lot, and polydipsia, you are drinking a lot. You just find yourself drinking for no reason, go check. But so urinating a lot, especially you're waking up more than once or twice at night, you're very thirsty, you're losing weight without, you're not trying. You're not trying to lose weight, but for whatever the weight is just falling off you, go and check it out. You find yourself very hungry, your vision is blurry for no reason, you find yourself very numb, tingly in your hand and feet. I mentioned it when I showed those images earlier on. Go and get checked out. You feel very tired, dry skin, sores especially in your feet that are not healing. You having more infection for no reason. Go and get checked out. Now, how do we diagnose the blood test that we do to check for diabetes? If you already have any of those symptoms I listed in the slide earlier on, and your doctor checks you and your fasting, FPG just means fasting blood glucose, and your fasting plasma glucose is 126 milligrams per deciliter. In Nigeria, they use the milligram deciliter. So if your fasting plasma glucose is 126 milligrams or more, here in North America, we use 7 millimoles per liter or more, you're diabetic. If you don't have any symptoms and you have those readings I just called, then what we tend to do is we'll repeat on another day. And you have to have been fasting for at least 8 hours. So even if you have no symptoms and you get 7 millimoles per liter or 126 milligrams per deciliter, we say, let's repeat the test another day. But if you have symptoms and you get this, that's diabetes. And the point is we should just progress to treatment. There's another test we do. It's called the HbA1c. If your HbA1c is 6.5%, that's expressed as a percentage, and you have symptoms, that's diabetic. If it is less than, if you have no symptoms and it's 6.5, we want to repeat it another day. And then the other test that we can do is the 2-hour postprandial, or what we call the random glucose. If any of that is done and it is 200 milligrams per deciliter or 11.1 millimoles per liter, and you have symptoms, that's diagnostic. If you're not, then it should be repeated another day. So, the point next thing is, how do we treat diabetes? I made 3 slides on treatment. How do we treat diabetes? First thing is, prevention is always better than cure. Prevention and early diagnosis. So prevention just means eat well. Don't eat junk. Get involved in regular exercise. Regular exercise is not just we're lifting weights. There's nothing wrong with lifting weights, but as physicians, we prefer what we call the aerobic or the cardio. And when it comes to that, we like at least 120 to 150 minutes per week. Not done in one day, but that is 25 to 30 minutes of cardio 4 to 5 times a week. That is, cardio just means things like running, jogging, boxing, dancing, things that bring up a sweat.
All right. Sorry, if I can come in here, sir. So, yes. So, trying to tie this is a medical thing we're doing, but I'm thinking in my head, trying to tie it to responsible Christian living, if I might call it that way. So to my mind, I think that as Christians, we should live in such a way that we take care of our bodies, we handle our bodies responsibly. For example, when we're not well and we have some kind of, I don't know, chemical or mental imbalance, we're depressed or something, it has a way of skewing our minds, and on the other side, when we're healthy, we're doing well, we're thriving, I think it has also a good effect, both immediate and long term, on our spiritual life, because when we're not well, it sort of things toe downwards, it becomes a distraction, becomes our focus, So prevention. So what does that mean in practice? Should I, because what I've heard, let me just ask you directly, so you can spell it out for us. Should I avoid all sugar, all drinks and food that contain sugar? Can I even avoid all foods that contain sugar? What exactly does prevention mean in a daily basis?
Yeah, thanks. It's not really practical to avoid all foods or everything that has sugar. Okay, coming to sugar, there are sugars that have what we call the high glycemic index.
Like which one?
Your Coke, your Fanta, those are not really foods, but they are drinks.
Soda.
Soda, the refined sugars generally.
Refined sugars, okay.
Yeah. Let me see. I actually made a note. I'm just not. Let me see if I'll find it. I don't know if I even brought it down. But the point is, okay. Let me. Okay, since you ask, so the easiest way for me to come at it is, imagine you have a plate of food in front of you. Let's say rice. Let's say you are eating rice. So your plate of rice is there. So half of your plate ideally should be something like vegetables. 1/4 of the plate should be your rice, and the remaining 1/4 should be your protein.
Okay.
Or at least eat more of your protein and your veggies, and then
And you eat
less and less
carbs.
of your carbs, because you still need carbs. Carbs give us energy. Otherwise you'll find yourself not being able to function. And then the refined carbs, like your cake, the cake, the
You want to
cookies.
avoid those.
Yeah, avoid them as much as possible. And in moderation, drink more water than those things that are easy for you to. The other thing is, those refined ones, they even want to make you eat more. That's the problem. Those your Coke and your Fanta, not only do they go straight, they're energizing. Immediately you drink them, you feel
Yeah, you
good.
feel
Then the
energized.
problem is, they also want to make you eat more.
All right.
And they are the ones that also make you fat, because you eat more and then you get fatter and then you get lazier. You don't want to exercise. Now, remember the Apostle Paul writing to his protege, Timothy, in
Timothy.
First Timothy 4:8 says, bodily exercise profits little. I personally believe what he's saying there is he's talking about this side of eternity. We won't need exercise in heaven. On this
Yes.
side of eternity, exercise is profitable. And we should indulge in it, so that we can fulfill the ministry that God has committed into our hand, that we can live healthy and be able to, commit
Do the,
the
do the
assignment
work he has called us to.
that God has called us into. Let's do it. So
Yeah.
it's not about avoiding sugar. It's not about avoiding sugar, but it's about eating the sugar in a responsible manner.
In a responsible way and not
Yes.
indulging. I think that there's a verse in the Bible that I'm guessing Proverbs where it says something like, "My son, if you find honey, don't eat too much.
Aha.
Take it in moderation. Take only a little, just what you need,
Please, if you can
and
find it,
move
let's
on."
you
All
can
right,
find it for us.
as you're talking, I'll look for it.
Okay,
Yeah.
there you go. Now, Early diagnosis is important, and that's why I said earlier on that people should endeavor to get checked out. So if going to weekly anointing service is not the way to get healing. Oh. I personally have lots of pastors and general overseers. I've treated many. These are the same people who also anoint people. Don't get me wrong. There's nothing wrong in getting people anointed, but I'm telling you, I also have anointers as my patient. All right. So if anointing is the panacea, then they will not need to be my patient. All right. Okay. So just get. I hope you understand. I hope you are getting sense. Okay. Even anointers need physicians, and I will not go any further. So, and I anoint people who anoint people also get sick. They need physicians. Everybody, whether you are anointed or you are the one doing the anointing, get regular checkup.
All right, so I found the Bible verses in
Thank
Proverbs
you.
25, Proverbs 25, verse
Read it to
16.
us.
Reading from the ESV, it says, "If you have found honey, eat only enough for you, lest you have your fill of it and you vomit it." But there's an interesting twist to it from these Bible translations that I don't like, but I'll just read it for effect. From the Message, it says, it is not smart to stuff yourself with sweets. The Message, I think another version says, when you're given a box of candy, don't gulp it all down. Eat too much chocolate and you make yourself sick. These Bible translations are really something.
Okay. Actually,
Yeah.
I sort of like them. Even though I don't like free translations.
Yes, yes,
But I
yes,
particularly
yes.
like these ones.
All right.
Thank you. So, um, so early diagnosis is important. That simply means go for yearly checkups. All right, go for yearly checkups and go for yearly checkups, and so that's where we can pick up. And that doesn't mean you get obsessed with it. You still have to live. Don't be
Yeah.
afraid that you are going to get diabetes and therefore I see people. Some people ask me they are not diabetic, but they want me to give them a prescription for blood sugar so that they can be checking every time. And I say, no, you don't need blood sugar. We did your blood sugar during. We checked your blood sugar during your last month. And your blood sugar was excellent. Why do you want to be checking blood sugar? Oh, I just
All
want
the
to be
time.
checking. I said, no, go and live your life. Your blood sugar was nice.
Sometimes it's the paranoia of having
Yeah,
seen
it's
this thing play
anxiety.
out in real
Yeah.
life. Because, like, for example, I remember a family friend, actually a relative, distant relative, who died of this, and how they had to amputate this, amputate that, until the person gave up and all that. All kinds of. I have a friend even till today who lives. He's managing diabetes, and it's incredibly difficult. It's incredibly difficult. So on a general note, I'm not a doctor, so you're here to correct me, but what I think is that sometimes I think there is a connection to faith. I see you have one of the bullet points, role of faith. To connect it again to faith, I think there is a sense in which it might be sinful when we don't take care of ourselves. It's just like you'd say cleanliness is next to godliness. There is a certain level of responsibility, of self-control, that I think believers should exercise. In like the verse we just read and laughed to, about not eating too much honey. Eat what is enough for you. Don't go crazy. Don't say, some of the things that all these, we should avoid unhealthy lifestyle. I know of, I won't mention his name, this very powerful preacher that is loved both in reform circles and outside reform circles, who used to, and I don't know what your take is on smoking, sir, but just to draw I use it as an illustration. Things that are unhelpful, that you can avoid. Self-control should be. I was talking about this preacher that used to smoke a lot, to the point that another preacher rebuked him and talked and talked. And basically his answer, if I'll summarize it in a Niger way, is something must kill a man. He was hooked on this thing,
Yeah, it's an
and
addiction.
he was not about to give it up. And the man died young, and probably the smoking had something to do with it. So, and I don't think that this kind of life perfectly pleases the Lord. So, as a Christian, my spiritual life affects how I live. It affects the way I dress. It affects the places I go to. It affects the kind of people I hang out with. It also affects the way I treat my body, the kind of foods I eat, the kind of things I want to ingest. You know, for health reasons, because I mean, if you've ever had a health problem for which you were praying to the Lord, I think in those times you'd want to think, twice about, you want to take managing your health more seriously going forward, so you don't have to find yourself praying fire and brimstone and fasting, to get healing. Like you said, prevention is better, self-control is better. But what do you say, doctor, about sometimes these things? I hear that they can be genetic. No matter how healthy you live, no
Yes.
matter how self-controlled you are, you might still end up coming down with them.
Yes, absolutely. And I mentioned that actually earlier on, that family
Okay.
history plays a role. Um, so I mean, and you can't fight your genes, unfortunately. But we have no way of predicting whose genes will act up. But one thing you don't want to do is give fuel. So your dad has diabetes, your risk is already high, and then you
Yeah.
start eating junk and you don't exercise, and I mean that you've already helped help that along. Now you're absolutely right. Smoking, unfortunately, complicates the whole thing, but we also have to be uh, kind. When people get caught in bad habits like that, because that's an addiction too.
Yeah.
I deal with people who are caught in addiction and they're trying to kick it. It's not easy to kick it. I've seen people who are smokers and who just woke up one day and made up. I mean, George Bush, the former president, is someone like that. He was drinking, smoking, and he became a Christian. And one day he says, "I'm not doing this," and he gave it up just like that, snapped out of
Amen.
it. But not everybody has that kind of willpower. Uh, our beloved R.C. Sproul was smoking pipe, and he was in his early days, that is. But I personally think he had chronic bronchitis, and that was eventually what killed him. And he
What
lost
killed him?
it, yeah. But and that time it was too late. But hey, 78, he died at 70, at 78 years old. That's not exactly very
That's
young.
not bad at all.
Yeah, you know what I mean. So there is a definite role for that. But point is this: we should not be smoking is not good for you, and that's the truth. Jesus, our Lord, our Master and Savior Jesus, is the truth, and every truth that we can find, Jesus embodied it when he came
To
here.
live by.
And we should live by them. So it doesn't matter, just because it's not written in the Bible, thou should not smoke, doesn't mean it's not true. It is the truth, and we should live by it. Medical truth has conclusively proven that smoking is bad for you. It leads to lung cancer. It complicates diabetes. It complicates hypertension. It even damages your kidneys, and it reduces fertility. It's all encompassing. So it causes the chopping off of your legs too. So that's true. Now, just because it doesn't happen to every smoker doesn't mean that it's not bad.
All right. So we have a few. I don't know if we're rounding up.
I think let me
We have a
progress.
few
I'll come back to
comments.
it
Okay.
in the questioning.
All
Once
right.
somebody wants me to go back to symptoms, I've gone
All
over
right.
it, but I'll come back. All
Okay.
right. Yeah. So let's progress for now. So early diagnosis is important, and that simply means, and the way to do early diagnosis is go for regular checkup. Okay, let's not wait until what a lot of Nigerians do. One day they get a sore in their leg, and it's progressing, and then they accuse their
The
auntie as the witch who
enemies.
caused the wahala for them. So management of diabetes is lifelong, even if your physician decides not to give you medication. So point I'm making here is this: sometimes after somebody is diagnosed with diabetes, the doctor may decide you don't need medication. That doesn't mean that you're cured. That doesn't mean that you don't have diabetes. Sometimes we manage diabetes by using just lifestyle. We may decide, doctor may say, oh yeah, you have diabetes, but it's not bad enough, because you are very compliant with your with your medication, sorry, with your diet and with your lifestyle changes. You lose weight loss, and compliance with the with your food that you're eating sometimes is enough. Okay, but don't necessarily think, oh, the doctor said I'm cured. I've listened to people give testimony and say, oh, I was diagnosed with diabetes, and then 2 months later, my pastor anointed me with oil, and then they said my diabetes is gone. I'm like, sister, I beg, don't confuse people, the people of God. Your diabetes is not gone. Your diabetes is controlled. So continue to live a healthy lifestyle, continue to exercise, but continue to check your blood sugar, please. All right. What the role of faith is to help us in difficult times, just like in the life of Job. When Job was passing through all the adversity that befell him, he continued to look for God. He says, though he slay me. Remember that? Peter, go ahead on that one for me.
Yeah, though he slay me, I will trust in him.
Yes. No, I said, speak about that for a minute.
Oh, okay. About Job's comments.
Yeah.
Oh, okay.
I'm recruiting you here on the role
Oh,
of faith,
okay.
on the role of faith in illness.
Faith in illness. In fact, I had a thought while you were speaking. If you don't mind me sharing it, so could it be that one of the reasons why Christians generally we can be so irresponsible with our health is because we know that if push comes to shove, if something happens, we'll just go to healing school, take an bottle of anointing oil and mantle and go and get it sorted out, like all those fancy testimonies they've been hearing. Because I think one thing I'd like for us to share with people today is that even as Christians, justified by faith, sanctified by the Spirit, there are still consequences for the things we do. Barring, of course, the genetic angle to it and all of that. But when we don't do right, when we don't keep good hygiene, when we don't live self-controlled lives, when we don't manage our health well, what God has given us well, and it goes bad, we will have ourselves to blame. We will face the consequences. You will pray and pray and pray, and nothing will change. So I just wanted to reemphasize that there's such a thing as bearing such a consequence, bearing consequences for what we do, and which is why a program like this is really to pull our ears and to remind us, take a break and say, please, let's be mindful. It's just like, something like our economic resources, I would say. If you mismanage it and come to poverty, or you sit on your hands, like against what the book of Proverbs says, for example, a little folding of the hands, and things happen, you cannot come and blame God, and you cannot, so it's sort of the same thing. And I say this because again and again, I see Christians do things that, like you were talking about exercise. Let me use a small, very little example. So many times, when I have to do regular commutes, short distances, walkable distances, that will take me maybe 20 minutes to walk, 30 minutes, and I can walk it. Yeah, I don't need to drive. I would get up earlier most times as far as I can help it, and factor in that into my daily commute, or how I move about in the day. And then when some people seem like, you like suffering, no? How do you walk when you can take a car? I'm like, for crying out loud, it's just a 5 minute, 10, 15, or whatever, how many minutes walk. I'm walking because, and today we have this very sedentary lifestyle where many of us, much of our work, you do it in a sitting position. You're staring at a computer, you're sitting in an office, you're in class, you're always sitting down for the most part. You hardly ever walk, and so I find like I'm on the fight, like I'm fighting a losing battle, trying to explain to people that this is just a 10-15 minute walk. I'm doing it to keep myself active, to get my steps in. I have this thing on my phone that counts, the pedometer that counts my steps, do 5,000 steps a day, 8,000 steps a day, that kind of thing. They'll be like, this guy, you love to suffer. I'm like, this is not suffering. I've seen someone who had pains, who was, I don't know, it wasn't diabetes, and the way the person started praying, God, calling the God of the fathers. And I'm not saying this is what led to it, but I'm saying that many times the things we do on a daily contribute to all those things that end up becoming big prayer points for us. We start going from healing school to the other, going from one man of God to the other later.
Thank you. So the role of the pastor is to equip you with strength, with spiritual strength, to go through the valley of affliction, to keep your eyes on God, because God is glorified even
In suffering.
in suffering. It's theodicy, Theodicy. And Christians need to understand that God was not a lower God even in the life of Job, and he's not lower God when you go through diabetes or hypertension or stroke. But I've seen painful situations that I've been involved in. People have a stroke, people have a cancer. They didn't seek help in time. That's number one. That was painful to me, because you have stroke, and if you go into hospital early, at least in North America, we can reverse it. And people stayed at home a whole day before they eventually showed up. That was painful to me. They were praying, they were
Already
doing
late.
all sort of things. Yeah. And then, they're praying, doing all sort of things, which to me is not, I think it's Ecclesiastes 10:10 says, wisdom is profitable to direct.
To direct.
So that's, you don't need any, people who are even unbelievers do the right thing. Those of us who are Christian, we do foolish things, That's number one. You remember last year, a young
doctor.
man.
Sorry, doctor.
Yeah, go ahead.
Maybe we want to put it out there that to believers. I mean, I believe in divine healing, but you can pray in the hospital.
Yes, go to the hospital and start praying. Remember last year, a young man, an evangelist. I don't know if you remember. He had chest pain. This happened in Nigeria. He had chest pain, I think, in the hotel. From what I read, I don't know the man. I'm told he's a popular guy. Yeah. He was in his 40s. I mean, this guy's big, so that tells you something is not even right with him health-wise. It wasn't right. So he had chest pain, I think, earlier on. He didn't go to the hospital. And then because he had administration, and then he went onto the days. And right there on the days, he had a massive heart attack and he died. Right there, it's somewhere in the eastern Nigeria. He died.
Yes, I remember reading that story.
Remember?
I don't remember who it was.
So anyway, time. So
yes.
Avoid unproven social media. There are plenty of them. They all tell you they have this cured. Yesterday I saw one as I was scrolling. Put pineapple juices, add paprika, add onion. It has to be the red onion. Put water, then put it in your fridge for 7 days, and then drink. Add gogoro, and then drink half a glass twice a day. And in 7 days, your diabetes will go. Now lie. In fact, please, unproven social media cures. This thing, it cures diabetes, it cures hypertension, it cures it's Bobo and please don't follow them. Don't follow them. Now, most importantly, my brethren, I tell my patients this all the time. Even though I tell you, even though you like me, even though you trust me, I still want you to read. And there are excellent sources that you can go to. MayoClinic.org, for example, is a very important and very trustworthy source. Read up about, I don't want you to read up every medical topic in the world, but if you suffer diabetes, read up diabetes. Go to Mayo Clinic, put diabetes in there, read, understand it very well, and then come and ask me more questions. Because the more of that thing you're suffering from you understand, the better you are at managing it. Because I'm not going to be there with you every time. If it's hypertension, read it up. Whatever topic it is, go read it up. Find reliable sources. If you don't know what sources, ask me. I'll direct you. Okay? There are excellent videos on YouTube. And again, I'll give you the resources you need. Some of the other things you need to do if you are diabetic, you need yearly eye check. Even though the ophthalmologists can do, ophthalmologists are doctors, are eye surgeons. Let me put it that way. Eye surgeons. They can do it, but your optometrist, who is not a medical doctor, can also do an excellent job. So get a good optometrist whom you can go to. It's even cheaper, okay, for you to get an optometrist. It's good you find one. Don't go to one this year and another one next year if it's possible. That's where they can keep a good record. The reason is Sometimes, especially if your diabetes is not well controlled, it can damage the nerves at the back. It can damage your retina, the back of your eye. So that's why it's important to get a very excellent control of your diabetes. But excellent control or not, yearly eye checkup is important. Your blood pressure control becomes pretty important now, because uncontrolled blood pressure working together with your diabetes can do damage to your kidney and can do damage to the blood, to your heart also. Remember I said earlier on, kidney damage and as well as heart attack are things that are intertwined with poor diabetic control.
Yeah.
We need to control your cholesterol. Okay, so diabetes doesn't come alone. It comes with what we call microvascular changes. That is the tiny blood vessels which are in your nerves, in your kidney, in your eyes. These are the microvascular where you have microvascular changes. But there's also what we call macrovascular changes. Like the damage to the legs. Where that's why diabetics get their legs chopped off. So we also check your urine. These are things that your doctor will direct you, and then you need to pay regular visit to your physicians. Your doctor will direct you on that, whether he wants to see you every 3 months or every 6 months. But please, once you're diagnosed with diabetes, don't go to your doctor every year anymore. You need to go either every 3 months or every 6 months. Listen to what your doctor says. All right. And when I say your doctor, I'm talking about your medical doctor or your nurse practitioner here. Okay? Not your babalawo, not your herbalist, and certainly not your pastor. Go to your pastor for prayer. But when it comes to medical advice, it is your medical doctor we're talking about. Okay?
All
Go to your
right.
pastor for spiritual advice, but go to your medical doctor for medical advice. All right. Unless your pastor is also a medical doctor.
All right.
Now, this is the treatment. This thing. So I already mentioned regular. Myself and Bro Peter mentioned regular aerobic or cardio type exercise. If you are doing weightlifting, that's also good, but that's for sculpture. It is cardio we're interested in, and we're interested in 120 to 150 minutes weekly, divided of course into about 3 to 4 days. It has to bring up sweat. Sometimes just the exercise and the diet. The diet, as I described the plate, a typical plate of food should be half in your vegetables, protein, especially things like beans and lentils, your white meat, and then the remaining 1/4, your carbs. So you shouldn't be eating 4 slices of bread, please. Okay, you shouldn't be eating 3 slices of yam. Okay, you can eat more veggies. Okay, and you shouldn't be drinking 2 odekus, 3 odekus, and 2 cokes. In fact, you shouldn't be drinking coke unless it's maybe the zero or I don't drink coke or Fanta. So
Even the zero, they sweeten it with
this
some substances that have
yeah.
been flagged as being
There you
problematic too.
go. And for your tea or coffee, you can use the sweetness. Okay, you can do that. I mean, and people still need to feel normal. So, but no sugar. Take out sugar. All right. My wife is not diabetic, but she hasn't used sugar for a long, long time. She uses honey or the sweeteners for over a decade now. That's what she's been using, and she
Wow.
says it's fine. Okay. Now, your doctor will determine which medication. I deliberately didn't mention medication. About 2/3 to 70% of people who are diabetic will actually need more than one medication. Because I'm focusing on type 2 diabetes today, people with type 1 diabetes will need insulin. That's a given. If you are type 1, because with type 1, your pancreas is damaged, you are not
You
producing
can't
any
produce
insulin.
insulin.
Yeah, you will need insulin replacement. But people with type 2 diabetes, your doctor will most likely, if he or she has decided you need medication, if exercise and diet will not be sufficient, he will put you on medication. But 70% of people will need more than one medication. In fact, you may decide you even need to add insulin, because sometimes we do add insulin. So that's a decision he or she will make for you. There are new agents these days which is we call them the GLP-1 agonists. There are also injections. There are tiny injections like Ozempic or Victoza or Byetta or Ribelsus. Many of them are once a week. They are not insulin, but they help to reduce absorption of sugar. And unfortunately, there's a scarcity, especially of Ozempic these days, because people have found out they also help to reduce weight. Okay, so people are now using them as weight loss medication. Okay, they are becoming pretty popular, especially in North America, for blood sugar lowering. Now, we aim for blood sugar control. I'm emphasizing it. Blood sugar control for life, not cure. It's blood sugar control, not cure. And there's no reason. It saddens me when I hear people are dead. What killed them? People are dead at 50 years. People are dead at 55. What killed them? Oh, diabetes. There's no reason why anybody should die from diabetes at the age of 45 or 50 or 55. You're diabetic, you should be able to live until 80 or 85, until 90. I have diabetic patients who are 90 years old. Okay, you shouldn't die because of 55 because of your diabetes. No. Okay, please take care of yourself. Now, in terms of blood sugar monitoring, these days, unless you're type 1 diabetic that needs to be checking your blood sugar 4 times a day. If you're type 2 diabetes, you really don't need to be pricking yourself often. Doing your A1C, one of those tests that I said we can use to diagnose, we can do that once every 3 months. Okay, and remember I said earlier on, is expressed as a percentage, and that's what it is. Now, this image you're seeing is deliberately color-coded like a traffic light. Can you see it's green, going on towards amber, and then red? The ideal thing is we want your blood sugar to be 7%. It's done every 3 months. Remember I said that every 3 months. The ideal control is 7% or lower. That's the ideal, 7% or lower. Once we're treating you. Again, I'm using the word treatment loosely. Treatment may not even involve medication. It could just be diet and exercise, but your doctor may decide you need to be on medication. Typically, if your A1C is about 8% or higher, we're going to put you on medication. Okay. Now, but as people get older or they are frail, we may decide not to go for a target of 7%, maybe 8% or even 8.5 may be a target. We move that target depending on the age or frailty of the patient we're dealing with. So if I have someone who's like 80%, who's not as strong or as agile, getting that person a target of to a target of 8.5% may be better. But if I have someone who's like me, still as young as myself, I want a hard target of something like 7% or less, for that kind of person. All right. I don't want a hard target of 7% for my 85-year-old patient, and then they start getting low sugar and they're falling down and they break their hip. Yeah, that's not good for grandma. All right, but this is how we go about it. Certainly, I don't want anyone around 11%. All right. What you're seeing here is, for instance, someone with an A1C of 7%. What that means is their blood sugar, if you're using the blood sugar meter, is around 8.6%. So that would be something like about 150 milligrams per deciliter if you are in Nigeria. Anyway, so complications of that type 2 diabetes, we already spoke about it. Things like blindness, that's what you're saying there. Diabetic retinopathy just means blindness. They can have heart disease, they can have a stroke. We see that often. High blood pressure, it tends to be intertwined. We can see kidney damage, meaning kidney failure, that's what we're talking about here. And when your kidney is damaged, it just means, you see people with dialysis. dialysis is aimed at one thing. Dialysis is never an end in itself. It just means when you see someone on dialysis, it means they are waiting. It's a transition to kidney transplants. And unfortunately, you guys know in Nigeria, I think there is only 1 or 2 places where we do kidney transplants in Nigeria. That's sad. Okay, so kidney dialysis is a very expensive venture, and it is worse when you keep dialyzing someone without a kidney transplant program. And so everybody has to go to India, and looking for someone to donate a kidney. So kidney dialysis by itself is not a program that ends there. Because if you dialyze someone today, in another 2 or 3 days, they need to be dialyzed again. You cannot keep doing that forever. You need to put another kidney in place. It's very exhausting. Diabetes can be very exhausting. All right, can be very exhausting. So depression, anxiety, name it, is all there. It can cause nerve damage and it can lead to amputation. I don't know how many people you know. A popular Nigerian actor had his leg, even though I don't know the particulars of his illness. A comedian, somewhere in the eastern Nigeria. He was all in the news, social media last year.
Stable.
Yeah, his leg was amputated. I have a feeling there is diabetes
Related.
Yes, related. All right. I think that's our last slide.
All right.
I think, bro, did you said I should go over
the symptoms? I should just touch on the symptoms again.
So let's see. Yeah, here we go. So just remember, I said 3 P's: polyuria, polyphagia, polydipsia. These are medical jargons. Polyuria just means people peeing a lot. Polyphagia means people just finding themselves eating a lot. And then polydipsia, excessive thirst. Yeah, so I should go slowly. So I'm going slowly. Urinate means peeing a lot. And peeing a lot also means, so typically many people will wake up once or not even wake up at night to pee. And when you find yourself waking up 2 to 3 times at night for no reason. So previously you not wake up at night or wake up just once to pee. Now you're waking up 2 times, 3 times. Now there are other reasons why that can happen. But if that's happening to you, doesn't mean you have diabetes, but it means you should go and get checked out. You're finding yourself very thirsty. Even though you are eating a lot or you are eating normally, but now the weight is just falling off you for no reason. And of course, if you are peeing a lot, you are drinking a lot, you are eating a lot, and the weight is falling off, people tend to get tired.
Yeah.
That's diabetes. Your vision is going, and numbness, tingling, dry skin for no reason, even though you are creaming yourself. And a sore, people getting sores, especially on their feet, that's not healing or that's healing slowly, or having more infection. People are getting pneumonia for no reason. These are all reasons to get checked out. Something I didn't put in the slide. One of the things we tell patients who are diabetic is they need to get their immunizations up to date, especially immunizations for pneumonia and maybe shingles and their yearly flu shots. You need to get those immunizations up to date, because pneumonia reduces immunity. Chronically, it reduces their immunity and it increases their predisposition to getting infections in general, but especially things like pneumonia. So go get your shot, your flu shot, your pneumonia shot, so that at least it helps boost your immunity against those particular infections. Thank you.
Thank you very much, Dr. Aditola. Thank you. I hope this has been helpful to everyone who has joined us. We had people from Facebook and YouTube and Twitter join in. All right. So thank you once again. I think we've gone over all the comments and we have. If you do have any questions after this, you can post it under this video, under this stream. Dr. Aditola will see it and respond afterwards. So thank you once again. It's weekend. Go be with the Lord's people on the Lord's Day. Tomorrow is Sunday service in most places around the world. Go join in to worship, to serve, to fellowship. Don't be an online church member. I know the internet has made that a thing. Go be with the Lord's people. All right. Thank you, everyone. God bless you, and bye-bye.